How I wish that I could see. Thought that
Triste na kanta Gihilo mapagalis Iboti tumispasyo gisaro Bonita na Palawan Kung bonito taki Iguini fiu Imuagahe na pagi Neni hoguha na Palawan Neni hoguha winaltaku Hoguha ilalamu para todo itiaku Hogu na Palawan na Palawan
Leon Guerrero, Magahagan Guahan, Governor of Guam,
Hafaday and good afternoon.
as well
Thank you
as
so much
Department
for
of Public
joining us
Health
for
and
today's
Social Services
COVID-19
Director,
press
Artson
conference.
Augustine.
At this time, I'd like to recognize the presence of the
To
Honorable
his
Lourdes
left,
de
we
Leon
have
Guerrero,
Dr. Felix
Magahagan
Cabrera,
Guahan, Governor of Guam,
Chief Medical Officer
as well as
for the Department of Public Health and Social Chief Public Health Officer. At this time, I'd like to give the floor to Governor Leon Guerrero for her remarks.
As I have said throughout this pandemic, Guam's recovery won't be like flipping a light switch. It will be like watching the sunrise. It will be slower than any of us want. It will be measured throughout this pandemic. Guam's recovery won't be like flipping a light switch. It will be like watching the sunrise. We're able to fully vaccinate 50% of our eligible population, or 62,500 of adults 16 years and over. We would reopen our borders, welcome tourists under certain conditions, and take a big step towards normalcy. Or 62,000. As of April 29, 2021, over 64,000 of our people have been fully vaccinated. Take a big step because of all of you, we have reached our goal. April 29, while we are proud of our people for doing their part to rebuild a stronger Guam, we must also acknowledge that our goals must reflect of all of the situation before us. Our goal. With the recent clusters, people for doing recent cases caught in quarantine, and increase in the number of COVID hospitalizations, we are delaying the update of our quarantine protocols for another 2 weeks. of Guam, thank you for doing your part to keep our island safe. And we can only reopen safely if we get vaccinated. So I highly encourage you to please roll up your sleeves and get vaccinated. Only reopen safely if we get vaccinated. So I highly
Thank you so much,
encourage
Governor.
you to
Now for remarks by Public Health Director Art San Augustine.
Thank you, Chris. Thank you, Crystal. Good afternoon, Governor. Inasmuch as public health and social services supports our economic recovery, we are also balancing this aspect of our community with the responsibility to protect our public's health. In the face of the pandemic, we are moving forward with vaccinations, with 64,047 individuals having received their second dose as of April 29, 2021. While there is progress in this effort to protect our community, there is a recent confirmation of community clusters that Public Health and Social Services is investigating and monitoring. Therefore, I ask our Guam family to come out and get vaccinated, as this is the measure we can take towards achieving herd immunity. And while this measure is another layer of protection to contain the virus and protect ourselves, our family, and our community, there is a reality that we have members of our community who have not been vaccinated. In our effort to move forward with vaccinating our community, Public Health and Social Services has partnered with the Archdiocese of Agana. We will have vaccine sites on May 8th at Our Lady of Lourdes Church in Jigo, on May 15th at St. Francis Church in Jonia, and on May 22nd at the Santa Teresita Church in Manila. We must do our part in as much as possible to vaccinate Guam. As numbers were low in hospitalization and positive cases before the recent clusters were identified and announced last week, the recent increase in numbers have raised concern in our effort to reopen Guam. DPHSS continues to monitor these situations, and through time will be able to determine the extent of the web of close contacts. Further, as we have been contemplating the reopening of our island, Public Health and Social Services continue to work through the draft travel protocol. And due to recent COVID-19 clusters, the department has had to revisit the protocols. Our governor, Governor Lou Leon Guerrero, has been consistent in stating, while there is a target date of May 1, the reopening remains based on where we are as a community, where we are with our rates of positive cases, how many of our residents are hospitalized, and how many have passed in recent times. For Public Health and Social Services, reopening is really looking at shortening the quarantine time for our travelers, and also having a meaningful pathway to quarantine exemption. And while we monitor our local situation, we also have to keep in mind what is happening in other parts of the world that impact our lives, the increasing numbers of positives around us. Our local situation, coupled with international implications and the impact to Guam, is cause to pause at this time and to continue to investigate and monitor our situation before we step forward. As we have recognized throughout our journey, our battle with COVID-19, we have to be mindful of the limited resources we have to rely on here on our island, and to work towards maintaining our effort to contain the virus so we do not experience a stress to our healthcare system. Thank you very much.
Thank you so much, Art. I now like to give the floor to Chima Mbakwan, Acting Chief Public Health Officer, for updates on our COVID-19 clusters.
Good afternoon. Good afternoon. I have recent updates for the cluster that we reported a week ago. Currently, for the A-class lounge, we have no new cases identified at this point. Out of the total 14 people identified as positive cases, 8 have cleared isolation, 6 are still in active isolation. 1 is currently in the hospital. We have no new contacts, and the last release date for those in quarantine will be on the 24th of August, which has already passed. April, sorry. April. Okay. For the Subaki update, we still have not identified any new cases. Out of the 8 cases, 6, as we know, are employees and 2 are patrons of the Subaki Hotel. Right now, we do not have any new close contacts identified. We have 60 of the workplace contacts still in quarantine, and all the 60 of them will be released next week. But currently, we have tested 862 contacts from the Subaki and A cluster outbreaks. We still have 381 people that are yet to be tested from the number we have. But we're optimistic that these individuals would have tested, but did not indicate that they were contacts to these 2 clusters. But we also have today ongoing testing for anyone who would have been exposed to those clusters. As of today, in the past 7 days, since this started, Public Health has been able to test with our partners. 1,957 individuals have been tested. Out of this number, 1,927 of them are negative. We have 23 new positives from this test, and then we have 7 repeat positives, making it a total of 30 people already in the past 1 week that may be associated with these clusters. There's still ongoing investigation. We're still having repeat interviews with contacts and close contacts to still continue digging to see if we can find any new cases. So it's still an active case finding for Public Health. And for GMH, the 2 physicians that were tested on the 27th that were confirmed positives. In collaboration with GMHA, we've identified 46 suspected contacts that have been screened. 7 were identified as having prolonged contact with the physicians. Out of this, 4 have already been tested and are negative. 11 staff members were also identified as contacts, but are deemed as low risk. And I think what is important here is to note that while this case is ongoing and we're still investigating, there are people not in isolation there are people not in quarantine, because in collaboration with Public Health, we actually went in to look at the infection control protocols in place at the clinic, and there's a heightened awareness of infection control. The workers are in constant the workers are constantly adhering to the infection control protocols that have been put in place by the clinics. That is why we have a low to zero transmission rate in the clinic for now. But if you compare it to the other clusters that we have, you find out that both scenarios or both environments are different. In the hospital, there's a more controlled infection control protocols in place, but in the homes and in the bars or in these social gatherings where people tend to let down their guards, that is where we're having all these increased numbers. So we're still investigating, we're still discussing with GMH, and then we will continue to inform you if there's anything new. But right now, we've also been able to look at the time frame between the symptom onset and their travel, and we determined that there is no need for us to test everybody on the flight that they traveled on. And then finally, we still have ongoing investigations in 3 schools now. And these are identified as household contacts, but there are also students in some schools on the island. We're working with GDOE in case investigation and contact tracing. And as of now, there is no reason for us to worry about any new positives or any close contacts, because the individuals were identified and quarantined way before they were tested. One of them tested 10 days into quarantine, and that means the individual has been clear from the school, but we're still just looking back to see if there's any relationship to any other case. So this is the present situation with the clusters. Thank you.
Thank you so much, Chima. I'd now like to give the floor to Dr. Felix Cabrera.
Thank you very much, Crystal. Good afternoon, Governor. Good afternoon, everyone. I'm just going to share my screen right now and just give a brief overview on where we are in terms of the metrics related to COVID-19 on Guam as it is as of this morning at 8 a.m. So our current CAR score is at 0.7. Our test positivity rate is at 1.4%. Our retransmission value is at 1.2, reaching a peak of about 1.5 the past several days. And our daily new cases on a 7-day rolling average, which these values are all 7-day rolling averages, our daily new cases is at 7.3. Total cases that we have on Guam right now is at 7,959, and 84 of them are in active isolation. We still are at a total death count of 136. There are currently 5 patients hospitalized with COVID-19, and one of them is in the ICU on a ventilator. Our daily new tests that are done on a 7-day rolling average is 526, which is quite an increase over, let's say, 1 or 2 weeks ago when it was in the 300s. Our case doubling days is 739. For the past 28 days, our total cases have been 151. 107 of them have been community-related cases, and 44 have been travel-related cases identified in the quarantine facility. And so that makes it 29.1% of all our cases being travel-related. In terms of for the vaccination numbers, I'm going to move on to the next slide. We can demonstrate that a little bit better. So this is as of data available last night, April 29. And so as you can see here, total current with at least 1 dose of vaccine is 79,907. And this includes government of Guam, private, DOD, and Guam Army National Guard, or Guam National Guard in general. The total current fully vaccinated is 64,047. So when you look at our population that is 16 years or older, that's 125,589. That means that of that population receiving 1 dose at least, we're looking at 63.6% of them, and fully vaccinated 51.0% as of last night, meaning that we are above 50% at this time. But in viewing this overall, our total population estimate being 168,322, 47.5% of the whole entire population has received the first dose, while 38.1% is considered fully vaccinated. So because we have reached our path to half, there is a proposal that we would like to share in terms of the change in our quarantine protocol, but this is something, as the governor has mentioned, that it will not go into effect immediately. We will continue, we'll look at it in the next 2 weeks and assess where we are in terms of the cluster investigations and where things are locally. But we would like to share the proposal with the public so that they can begin understanding it and preparing as well. So this is the proposal. And so basically what you're seeing here is a proposal to transition and traveler quarantine into Guam. So the criteria for consideration of implementing the changes, I'm just going to highlight it here first, is that one, that we achieve 50% of adult eligible population fully vaccinated, and we have achieved that. Remain COVID hospitalizations less than 10, which is currently the case, and maintain a 14-day COVID death sum of less than 5, which is currently the case. So this is our criteria for consideration. This is subject to change at any time, so it's not set in stone. So the pathway here, in terms of if you were a traveler entering Guam, the first question comes up is, are you fully immunized with US FDA authorized vaccine, and do you have proof of vaccination? So first of all, the definition for fully immunized is that you have that you're 2 weeks after receiving your second dose of the Pfizer or Moderna vaccine, or 2 weeks after receiving the single dose of the Johnson & Johnson vaccine. And if that is the case, then you go down the yes pathway. And then at that point, there's going to be an immediate verification process. And this includes this. So one, it's that you have your CDC COVID-19 vaccination record card and one of the 2 other records here, a vaccinating health authority record, which is like from the local public health, or a vaccinating provider record, say from the doctor's clinic or pharmacy where you got your vaccine. And so in these cases, these can be immediately verified. I will announce that for all those here on Guam that have been vaccinated, you should have your card, but also you'll be able to obtain a copy of your vaccination record as well from the WebIZ as a printout, and that will be made available to you at no charge. So you will be able to obtain that fairly easily, and we recommend that prior to travel, and so that you have that upon return. Note that both random and targeted audits will be conducted directly with source of for verification, and travelers with evidence of fraudulent records will be subject to fines and/or penalties that will be announced at a future time. So if you can be immediately verified, then at that point, there is no further quarantine required. You can leave the airport or the port of entry. However, you must fully comply with symptom monitoring for up to 14 days via the SARA alert system that is in place. And that we highly encourage that you download the Guam COVID app. And let's say you cannot be immediately verified for whatever reason, you're coming from an area where you don't have the full documentation, then you will still go to the quarantine facility, and there will still be attempts to verify in other means, and hopefully that will be resolved within 24 to 48 hours. And if that is confirmed, then you will no longer be subject to quarantine. If it is unconfirmed, then you will continue with the quarantine process as it is. So that is for those who are not vaccinated. You will go down the no pathway here, and it will be status quo as it is right now, where you will go to QFAC and you will have the opportunity to test on day 6 and release by day 7. Here is another change in this process here is that we are going to be adopting the CDC recommendations for length of quarantine. And so if you are tested on day 6, then you are released after day 7, and there will not be a transfer to home quarantine because you will be done with quarantine at that point. But still, you have to fully comply with the 14-day symptom monitoring with the SARA alert, and of course, download the Guam COVID app as it applies. If you refuse testing or if testing for whatever reason is not available, then you will complete a 10-day quarantine, the QFAC, not 14. And so this is now what we are adopting. And again, what affords us the ability to adopt the CDC's current guidelines, because we were more conservative previously, is because we reached this 50% mark of our eligible adults being vaccinated. So at this point, we feel it is safe to adopt these this process and these shortened quarantine times. And it would be of note that this will also mirror for the community exposures. So those who are fully vaccinated, and if you are exposed to somebody who turns positive for COVID, you will not be required to vaccinate if we can confirm your full vaccination status. And also, if you are subject to the quarantine, there is the opportunity to test out and be released by day 7, after day 7, I should say. And so that will mirror both the travel and community process here. But again, this is a proposal at this time. We're providing this to the public so that there can be time to digest this and ask questions and start seeking preparations for those who may be traveling. And as the governor mentioned, that we look to implement this in 2 weeks' time and have the travel guidance that accompanies this flow chart. And with that, I'll stop share screen and hand it over to Crystal. Thank you.
Thank you, Dr. Cabrera. I'd now like to give the floor to our members of the media that are present with us in the Zoom room for their questions. First is Heidi Eugenio Gilbert.
Good afternoon, Governor. Governor, will you clarify that again? What are the things that we need to meet before we actually reopen tourism? And are we talking about May 16 reopening and easing of quarantine? Is that the date?
14 days from May 1st would be May 15. That is the targeted implementation of the changes of these travel restrictions. We will still have to continue with the criteria, of course, CAR score of 2.5 and below, hospitalization of 10 and below. And I think those are the main ones. 14-day, okay. 14th-day death sum of less than 5. And then we are also going to be giving this to to the airport, and they will also be establishing their procedures and so forth to follow this. But I just want to again reemphasize that this flow chart that Dr. Cabrera has put up is a proposal. We have to work with public health to get the guidelines and so forth to better identify the details of this workflow.
Governor, this is about the two doctors who recently traveled to India. What's your reaction to that? That they traveled to India against the recommendation of the CDC of a no travel advisory? And should GMH initiate testing to employees, patients, airport personnel, and others who may have been in contact with them when they arrived?
I don't really have any comments about, them traveling to India against the U.S.'s advice. The U.S.'s advice is just that. And it's then the decision of the traveler as to their choice of going to the place and knowing the risk and so forth. So I don't have any comments about that. That's their decision, and that's their choice. Chima's going to respond to your other half of the question about contact tracing and so forth.
Thank you, Madam Governor. But in reference to your first question that the governor answered, it is a CDC travel advisory. It's an advisory, and the risk is stated, and then when people decide to go against that, the chances are that the consequences will be on the individual. So we like the governor stated, we don't have control over that. What we have control is who comes in to the island, and we've been able to work with the airport and other partners to ensure that anybody who is coming into the island is either tested and quarantined. And if you remember clearly, these individuals are critical service workers, and they were coming from an international destination. CDC actually has a recommendation right now that if you're traveling from any international destination to the US, you have to have a 72-hour test prior to travel. And the reason is they want to make sure that nobody who is going to come into the United States has an active infection going on. So that alone, if they tested before their flight home and they were negative, then they actually followed the recommendation. And then on arriving to Guam, they followed the public health established restriction of movement for critical service workers that are allowed exemption from quarantine, which is going from your home to your workplace and back home, and also following the infection control protocols in the workplace. So for now, the individuals came back and they followed the recommended precautions in place in their workplace. And with the investigation that has been conducted between public health and GMH, we've been able to identify the number I stated initially. These are people that they came in close contact with. And this is a total of 46 suspects. But like I stated earlier, in the hospital environment, they have strict infection control protocols for all forms of diseases. The doctors are doubly masked. The patients are also masked. They have all those hand stations before they see the doctor, and they keep safe distancing. So what has happened in this case is that the individuals that were identified, 7 of them were the ones that had prolonged contact with them, which is not even up to 5 to 10 minutes, but they were identified as having prolonged contact with them. and 4 of them have been tested and they're negative. So we've identified close contacts, we've screened them, we've tested the ones that we assume or we know that should be tested and they're negative. We're still watching following up with the ones that are deemed low risk in the workplace. They are being symptom monitored until the 14 days that they are required to symptom monitor. So for now, we don't have any reason to panic, but at the same time, we still insist that we still employ that people should continue to follow the recommendations that is in line with reducing the spread of COVID on the island. Thank you.
Thank you. We'll wait for the next round.
Thank you, Heidi. I also want to acknowledge the presence of Lieutenant Governor Josh Tenorio, also with us in the Zoom room. Thank you, LT, for joining us. Maureen Maritita, Mariana's Business Journal.
Buenas, Governor, gentlemen. So you said, Governor, at the beginning of your remarks that the decisions you're making are based on scientific data. So I just wanted to ask, in Hawaii, if I remember correctly, when the state made the decision to open for tourism, which was towards the end of last year, their COVID positive numbers went up, I think, till February, although they're curving down now. So I'm wondering what happens when we get to that happy point where Guam reopens and we allow tourists to come to the island, if they will do so, if we can arrange flights, and our COVID numbers curve up. Are we going to close again based on scientific data, or are we going to lean a bit more to economic necessities and remain open?
Sorry, how I would address that is that I would look at what our herd immunity is. If we are about 80–90% vaccinated, I feel we are still really protected in terms of any severity of illness as a result of COVID. So we wouldn't be overwhelming our hospital system. So I think vaccination takes a very major role in how we would address those circumstances. And if we are at a 80–90%, which we are still really aggressively campaigning to get there, then our actions would be different than what it would be if it was, 18 months ago where there was no vaccination. I would also look at our hospital admission rates. I would look at what our hospital resources are and then act accordingly. That's how I would look at it.
If I may add.
Sure.
And so, in terms of making evidence-based decisions, I just want to ensure that that the public understands that what we're proposing in this travel change is a exemption from quarantine. And this exemption from quarantine meets the on-par risk reduction that we know exists with the current quarantine process as we have it right now. And part of that becoming on par is because of greater than 50% of our adult population being fully vaccinated. So there's assurances with that there's hard data that supports this decision that we'll be making. And if we see cases start rising, but hospitalizations completely stay flat, then that means that there's now becoming a disassociation with cases and hospitalizations, and not necessarily the same correlation of the CAR score with hospitalizations, which means that people may get positive, but they're just not getting sick necessarily that would have landed them in the hospital otherwise. So those are things that we want to look at very closely, and we will continue. So we won't have a knee-jerk reaction just because there's cases that are rising. but we'll still very closely monitor and see what's associated with the hospitalizations and hopefully not deaths. Thank you.
Okay, and with respect, I would also like to ask why on the eve of a date that we planned a symbolic reopening, if you like, we waited until almost the last minute to announce this. Did you not, were there no efforts to look at the trend and make the announcement a little bit earlier?
The efforts were made definitely by looking at the trends. The circumstances that happened within the last 5, 4, 8 days. So there is no intention here, Maureen, to hold back or to have any kind of I guess inappropriate kinds of decisions. These decisions were made as a result of circumstances that happened just within the last week and a half. So definitely, the intention there is not to wait till the last minute. The intention there was to look at the trend and to look at the circumstances and to look at what's happening with the numbers and to look at what's going on with the hospital admissions, and then be as flexible and be as quick to make the changes to protect our community.
Okay, thank you, Anna.
Thank you, Maureen. Jerry Partito, PNC.
Yes, thank you. Yes, Governor, with the delay in Guam's reopening now, are we still confident that we will reach the 80% herd immunity by Liberation Day for Operation Liberation?
Absolutely. We have reached our May 1st goal. There is, again, aggressive campaign towards meeting our 80%. And I'm very confident we can. I am also very confident that our people will continue to get vaccinated, to get their second doses, to make sure that they protect themselves and they protect their families. And so with those intentions, I think we will reach the July 21st Liberate Guam goal.
Okay, and my next question is, what's the reasoning behind the 2-week time frame? Is that enough time to tweak the screening and quarantine changes that you guys want to make? Why not make it longer?
Because 2 weeks is sufficient time. We've been looking at these protocols over the last month, and we've been actually preparing for the May 1st, and the 2 weeks is sufficient time to get all the logistics going. And plus, more importantly, Jerry, I think the 2 weeks will give us more time to even better be certain about the consequences of the 2 clusters that occurred a week ago. So that is why the 2 weeks is there, and to again make sure our numbers are still way within the contained standards and measures that we have set forth.
Okay, thank you.
Thank you, Jerry. Nestor Lacanto, KUAM.
Thanks, Chris. Good afternoon, everyone. Governor, there's a couple of stats that kind of jumped out at me, and I was wondering if you could comment on those, or any of the other panel commented on those. One is the 29% travel-related infections. Does that cause for concern? And then the second one is the increase in the rolling average. I believe Dr. Cabrera said, was it 500 now compared to 300 2 weeks ago? I was wondering if we could get some comment on that.
Hi, Nestor. Just first of all, that was the daily tests, just tests being run. We now average about 526 tests being run overall, and that's a response to trying to widen the net to identify and test more people out of the clusters investigation. Whereas a couple of weeks ago, our average 7-day rolling average of daily tests being done was about 300 some. So that was that 500 number there. And so that's, I forget what the first part of the question was, but oh yeah, the 29% travel. So yeah. And so these are persons who are being identified in the quarantine facility, and in fact, it's actually technically been going down. It used to be about 40% being travel related, and it's gone down to 29 some. But again, these are individuals that, upon not entire review, but in initial review, is that they are not vaccinated persons, and so that's a very important part here. The breakthrough of those who are vaccinated is extremely low, and we have confidence in that, in particular, even with the known strains that do exist of concern. And so with that, we are trusting the data to go with that, and we want to make this available to the public, because we don't want to quarantine people more than we have to overall, especially if they've done the responsible and right thing of going through a full vaccination process. And I mean that full. If you just got one vaccine and you didn't get your second dose, you do not qualify for the quarantine exemption. I want to be very clear about that. If you're not 2 weeks out of your second dose or your first dose of Johnson & Johnson, you do not qualify as being considered fully immunized. And so we are still have very strict requirements here that we want to adhere to. And so, but the last thing I just do want to say is that, this 2-week time period also affords the CNMI to review their processes and see if there may be an ability for us to have a reciprocal process where the fully vaccinated are verified and able to travel freely between the islands. And so that's something that I think is very worthwhile to do and do right. And I think that would be a tremendous boom to the entire Mariana Islands. Thank you.
And could you elaborate on the plan to go to the churches with vaccination? Why the churches?
Lester, to answer your question, public health has been in collaboration with a lot of groups, and the church is one of the groups. And if you remember, here on the island, our Catholic population is almost 80%. And partnering with the church is actually reaching a larger group. And the church has been working with us in other aspects like contact investigation, helping us review some of the school opening plans that we have for the schools. So this is an ongoing partnership with the church. But at this point, they are coming out to be in front, to ask the faithfuls to come out and get vaccinated so that we can get to that herd immunity. Because at the end of the day, if you have 80% on the island and 80% of the island is vaccinated, that would take us to that herd immunity that we're looking for. And the church has been very helpful in helping us, get to that number. So that is just a collaborative effort between us and them, like we have with other groups. Thank you.
And if I may add on to that, Nestor, if I could add on to that too. As you know, we have collaborated with other private clinics and Guam Hotel and Restaurant Association, and that has truly demonstrated success. And so our partners with the Catholic Church, the Archdiocese of Agana, is also an effort to really move forward towards these target groups, like target vaccinations, interest groups. So we're really working with smaller groups or larger groups, so that we could have industry specific. In this situation, it's our Catholic faith. And not only are the men of the cloth in support of this, they are also bringing their congregation out to support us in the operation. So it's a real partnership between Public Health and Social Services and the Archdiocese. And we really want to thank them for joining us in this effort. And so I just want to say thank you to the Archbishop and Father Ron. Thank you.
All right. No, the reason I asked it is because I was wondering if there was any maybe shortfall in the number of churchgoers that were getting vaccinated, because if I recall correctly, the church initially had some concerns about a certain vaccine that was related to a human fetus, but that's not been a concern. That was not factored in at all.
No, it wasn't, Nestor. They're shaking their heads no. Thank you, Nestor.
Okay, thank you.
Joe Titano from PDN.
Happy day, Governor, gentlemen. One question that I do have is, given that individuals who've been vaccinated are still capable of being a vector for the disease, what considerations are being taken for those who might, get the vaccination and get directly off a plane and be moved off be able to travel around the island without going into quarantine? They do have to get the Sarah alert, the COVID app and the Sarah alert, but are we going to be pulling those individuals back into quarantine? What considerations are being taken in order to make sure they're not spreading it should someone have it on their flight or anything like that?
I'll go ahead and take that question. So it's a tough question, but overall, the answer is pretty straightforward, is that one is that there's more and more studies that are showing that those who are fully vaccinated are very poor spreaders of COVID, even if they were to contract it, in the rare case that they were to contract it. And so that's one thing that's reassuring, and that we have that now. None of this process is 100% risk reduction. Even the quarantine facility as it is, and as we test people and test them out, that process is not 100%, and neither is symptom monitoring. But the risk reduction is tremendous, and it's greater than 90%. And so there is going to be a little bit of risk there, and we exchange that for the liberties that come with it. And that's why we still have to have a robust contact tracing process and quarantine and isolation. So let's say somebody is fully immunized, goes through the full process, is fully verified, and they don't quarantine, but they do the symptom monitoring. And let's say on day 6, they start having a fever. Then they test, and if they are tested positive, they don't go to quarantine, they go to isolation. And so that isolation process is still intact, and we will still continue with that. And we expect people to be responsible stewards of not just their own health, but the health of those they are surrounded by.
All right, thank you. And just one other question, this time for the governor. Governor, given that our primary tourism, given that this is sort of the first step towards making a comeback for the tourism industry, our primary tourism markets, Korea and Japan, still have relatively low rates. So as far as getting that back up and rolling, is there any other source markets that we're looking at? There's been talk of travel bubble that hasn't really gone anywhere. So what can we look for on the horizon as far as getting people back to work and getting tourism up and running with the low rates of vaccination?
So, yes, Japan is not really low numbers. Japan continues to rise. And in fact, they are in their 3rd surge, I believe. And in fact, the community there is not very favorable to opening the country up for the Summer Olympics. And so there is still a very concerning events with Japan. On your question about what other source market, we're looking at Taiwan also, which is a very strong, very potential, very good source market for tourism. South Korea, as you know, is also now going to be lifting their quarantine for returning residents. And that would be, again, a good measure for us to have South Korean visitors here, because as they don't have the barrier of when they go back home that they are going to be quarantined. So it's looking good. I think South Korea and Taiwan would probably be the first visitors back to our island.
All right, thank you.
Joe. Last but not least, Sophie Forsyth, Pacific Island Times.
Yes, thank you so much. I have a question for Governor Leon Guerrero. Where do you see the economy going this year, given the delay in tourism reopening as we get closer to the second half of the year?
Our economy right now, to me, looks very promising. As you know, we have opened all actually, of establishments and entities other than the senior citizen centers. So we have all our retails open. We have all our industry of services open. We have our restaurants open. Of course, there's still a limited occupancy, and that I'm sure will also be lifted as the numbers again become much more certain and much more solid. So the economy for me, as Sophie, is looking very hopeful. Construction industry is an area that never closed, and we're starting to see more activities in the construction industry. As you know, the barriers for the H-2B workers have been somewhat removed, and so we're starting to see a lot now of H-2B workers coming in. So we are also looking at diversifying some of our industries, and I'm very hopeful that that will be established and stood up. So yes, I know tourism is our major source of economy, but I think right now within our island, as we open up, we're starting to see more of the businesses. We're starting to see new businesses, and the help of the federal assistance of over about 2 billion dollars infused into our economy is, of course, a very positive assistance for us. But that's what it is. It is assistance. It's not a sustainable source of revenue for our economy. So I think we also need to protect our own island in-house economy, as well as economy coming out from outside sources.
Thank you. One more follow-up question. Are there any homegrown economic movements right now, such as new industries that may be shaping up?
Homegrown, I think I see some food catering homegrown. I see some crafts homegrown. I see some services homegrown where a need is seen, and then they establish that. So we are also very much, Sophie, supporting that those new creation of industries.
Thank you.
Thank you, Sophie. Going back around, Heidi, do you have any follow-up questions?
Yes. This is for the governor and public health. If arriving travelers are now fully vaccinated, why will Guam wait for 2 weeks to exempt them from quarantine?
Because we are not implementing these protocols right now. And as I have mentioned, and the director and Dr. Cabrera have mentioned, we want to look at 2 weeks from now, because we want to see how these clusters and these events that have happened in the last week, we want to see how those consequences occur, and also to provide the detailing out of the processes and procedures, so that when we do open on May 15th, that we open and we run with the program.
Can I add?
Thank you, Governor.
Just because the question has been asked a few times, just to say it plainly, if there weren't the clusters, then we would have had ample time to have this completely in place and go live, the beginning of May. I think that's we have a lot of assurances of that, because we have been working hard at this for months now in preparation. So again, being responsible to what we're seeing in terms of the trends, we want to ensure that these outbreaks are not consequential in a way that's going to lead to even more spread or more morbidity and mortality. And that's very, very important. And so we want to ensure that we're in the best shape to make this change.
If I could just add one other point is that, earlier there was a reference in terms of the timeliness of today's press conference. But if we go back, the second cluster was identified on the 20th, and we had a press conference on the 22nd. So it was very timely. But we are now needing time to do more monitoring and investigation. And really what we're wanting to do is just to be sure that there is no further widespread community spread. And so that we don't compromise our healthcare. That's all we're doing is being cautious. And I really want to thank the governor because throughout my journey with her and the pandemic, she has always been very calculated with regards to how her decisions are made. As a team, we listen to the physicians advisory group, the surgeon cell, the data, we listen to our subject matter experts, and we try to do what we best do, which is make the decisions in the best interest of our residents. Thank you.
Governor,
Go ahead.
oh, sorry.
Go ahead, Heidi.
The Guam Visitors Bureau yesterday said they're looking at the possibility of marketing Guam to American expats in the Asia Pacific region, such as Japan, Korea, Hong Kong, and maybe the Philippines, as a destination where they can get FDA approved COVID-19 vaccine while also vacationing. Is this something you support, or are there other ideas you want GVB to consider as they look to reinvigorate tourism?
Yes, Heidi, we have been discussing this idea, and I think it's something that is worth looking into more seriously. And I will be making a call with General Perna to see if he can give us additional vaccine supplies to address these population. I am very concerned about impacting our supplies for our own residents and our own people. But if we can get extra supplies or added supplies to our volume of vaccination, I think that would be a great idea to pursue.
Thank you, Governor.
Thank you, Heidi. Maureen, do you have any follow-up questions?
Yes, I do. So, assuming all goes well and we institute a program where if you've been fully vaccinated, you don't have to quarantine. We'll be offering that to anybody, correct? It doesn't matter where they're coming from, as long as they test appropriately and follow the guidelines for their stay in Guam. So I was just wondering if we'll be reaching out maybe to the CNMI, some of the other islands, so that if our people travel there, they can be similarly received and have their vaccinations recognized also. The CNMI, for instance, recognizes its returning residents as having the ability to go home rather than to the hotel property they're using.
Right. Yeah. So, Maureen, this is something that we are reaching out to the CNMI. Our public health team is discussing this with the CNMI's public health team. I am envisioning it to be a sort of like a passport of travel. We can call it vaccination passport, so that it's just smooth. You show them, it's verified, you go and do your business, you come back, you come home, you show us your vaccination, they're verified, you can go home. We want to be able to go back to really free traveling with very minimal inconveniences, and still be able to track and monitor our COVID.
Okay, thank you. That's all I needed. Thank you, everybody.
Thank you, Maureen.
Thank you, Maureen. Jerry, do you have any follow-up questions?
Yes, Governor, you said earlier that a big part of the adjusted reopening plan will be proof of vaccination. Will we be accepting all vaccines or just the 3 that we have now? because some of the countries are using different countries. I
Yes,
mean, are using different vaccines, and also,
correct.
and also, how would we guard against forged vaccination papers, because that has been known to occur also.
Yes, we've discussed all of that, Jerry. Right now, we are only allowing US FDA approved vaccines. So if Pfizer is being used in the international, that's a US approved vaccine. So we would be honoring those. As far as fraud, yes. We also talked about it. That's why we are requiring a CDC COVID 19 vaccination record card and a letter or a health authority record from the entity that gave you the vaccination. And that is one way that we can help prevent fraud. People are smart and they'll take things and take advantage, but we feel that that's one way of deterring fraud. Plus, of course, we are looking at fines if those cases are found. You want to add anything?
Yeah, I'll go ahead and add. And so one is that, yes, this is, as was presented in the flow chart, that the first question was fully immunized with US FDA authorized vaccine. And so that's the first part. And there will be a consideration for WHO recognized vaccines as well. But right now, we're keeping this tighter and we want to just recognize that US FDA authorized vaccines. And second part here is that we are making it clear that you should have your card. If you lost your card, find a way to get it to be resubmitted. And also get the vaccinating, usually the local public health that can have a record, a report or a printout of your record of vaccine, or to your provider that gave you the vaccine, like the doctor's clinic or a pharmacy, for example. So those are, but then I think an easy question that somebody may have is that, okay, Pfizer's being given in Japan. I got a Pfizer vaccine there. They're not going to have a CDC COVID-19 vaccine record card, but they may have an equivalent. So that's why in the pathway that was presented, and this will be shared, the slides I'm sure we shared with the rest of the media, is that there's an immediate verification that happens at the airport. And that's going to be much easier for those who have gotten their vaccines here on Guam or in the CNMI, for example. But then there's a secondary part where it may take 24 to 48 hours to do additional verification. Let's say if you're a traveler coming from Japan, but we would do our best to not make you be subject to quarantine more than the 24 hours, and maybe it will only be a quick, especially if it's arrival during business hours, might be quicker to verify. And so we'll make all those accommodations as we can. But yes, it is an important part. It takes a lot to produce a fraudulent vaccination record, and it may cost you money, but guess what? Getting a vaccine is free and it's a lot easier. So just get vaccinated.
Yes, thank you. And I have my last question for the doctors. There has been talk in medical circles that a third booster shot may be necessary to keep the vaccines effective. Are we prepared for this, or are we preparing for this?
So be very clear, the discussion in the medical community is not that there is a guarantee for a booster shot that's going to be necessary, a third one. And we can't say that in all, because the initial people in the trial, from the early trials, are only 6 months out. And so far we've had excellent data that shows that both the Pfizer and Moderna vaccines are very effective even after 6 months, more effective than even somebody who's had a natural infection. So they're already seeing that. So there's no way we can say what's going to happen in 12 months. And so that announcement, I think, came from an executive from one of the companies predicting that a third booster shot may be needed. But that's not what the medical community is saying, because there is no data to say that at this time. And maybe there will, but right now the data is not there.
Okay, thank you, Doctor.
Thank you, Jerry. Nestor, any follow-ups?
Yeah, just one thing, Chris. Governor, I assume you'll be extending the public health emergency declaration.
Yes.
Okay, and the
Nestor,
reason is probably
you'll be
obvious, but
signing
could
it
you,
right
could
after
you
this press
explain why?
conference.
Because we're still in a public health emergency. We're still experiencing test positives. We're still experiencing admissions to the hospital. Around the environment around us on global wise is raging with the with the virus. So want to keep us still in a public health emergency, again, to quickly access resources and to be able to address in a situation where if we do experience, God forbid we don't, arise again in our positive rates.
All right, thank you, Governor.
Thank you, Nestor. Joe, do you have any follow-ups?
Hi there, Governor. So if we're on track to reach our Liberation Day goal of 80%, what kind of restrictions being lifted? What sorts of freedoms are we liable to see if we hit that goal?
We'll probably have a more increase in social gatherings. We'll probably be able to open up more again our travel. We'll probably be able to increase occupancy in our dining areas, our restaurants, and more increase in occupancy of our churchgoers and other areas.
I believe we're at 70% right now. Are we liable to get to 100% at any point?
I would love to get to 100%. We can.
Good. All right, thank you.
Make sure you wear your mask, Joe.
Thank you, Joe. Last but not least, Sophie, do you have any follow-ups?
Yes, I do have one more follow-up. Once we reopen the tourism industry, and that's now around May 15th, do you expect a major spike in visitors or a slow increase as the months progress?
I expect a very, very, very slow visitor arrival. And I think the GVB industry is, of course, expecting that. We don't expect more tourists to come till, say, maybe second, third quarter of 2022.
Okay, thank you so much.
Thank you, Sophie. I'd now like to give the floor back to Governor Leon Guerrero for her closing remarks.
Yes, thank you very much. I'd like to thank Dr. Cabrera, Art, and Chima for being part of this press conference, and of course for all the efforts that they do to address this pandemic. And I just want to say, please, the biggest campaign now that we need to do as a community is to get vaccinated. And one of the reasons that we are also reaching out to the community is we want to make it as easy and as accessible and as convenient to our residents to get vaccinated. Till we reach 80%, and we will go further and reach 90, and of course 100% would be excellent, but we don't expect 100%. But the more we vaccinate, the more we can open up our island, and the more we can get back to some normalcy. This delay in opening the tourism is just a delay. We are targeted, and we are in the direction of reopening our tourism. And as Dr. Cabrera said, if we did not have these clusters, we would have been able to open today or tomorrow. And so that just gives us a point and makes a very strong point that one person who is positive and symptomatic and has gone to 3 events have caused 20 more positives and have caused concern in the community. And that's the concern that we have around the delay of this reopening. So if we want to get back to normalcy, and I do, everybody does, please make sure you get vaccinated, make sure you wear your mask, make sure you social distance. I am really hoping that by the end of the summer, that we will be at least 90% and that we will go back to some normalcy. I would love to be able to open up the island for Christmas, for the holidays. But I'm not going to feel comfortable doing that if we do not have the herd immunity that we need to protect our people and to preserve our healthcare system, to be able to service other non-COVID patients. So again, I am appealing to the people of Guam to please be vaccinated, wear your mask, social distance. I know I know it's very taxing to us, but if we can do this, we will be able to be where we are before COVID. Thank you.
Thank you, Governor, and thank you for all our media joining us today, and for those watching on Facebook live stream or on PBS Guam. Please be safe.